Hi everyone, this is a detailed video of mine about stretch marks. Well, stretch marks are basically indented streaks that appear on the abdomen, breasts, hips, buttocks, or other places on the body, as you can see on these images when I opened Google. Okay, uh, they are common in pregnant ladies, and especially during the last trimester. Stretch marks are not painful or harmful, but some people do not like the way they make their skin look. Basically, patients come to us just for their appearance. Otherwise, they are not having any symptom like pain or any other symptoms. Okay, and normally these stretch marks do not require any treatment, and they often fade over time with or without treatment. They may never disappear completely. Okay. Now I'll tell you the symptoms. Okay. Well, as you can see in these images, stretch marks do not look alike. They vary depending on how long you have had them, what caused them, and where they are on your body and the type of skin you have. Common variations of these stretch marks include indented streaks or lines on the abdomen, and we also call them striae. Uh, Not only just abdomen, they can appear on the breast, hips, buttocks, or other places on the body. Also, the color could be pink, red, or they could be discolored, black, blue, or purple streaks. Bright streaks that fade to a lighter color. Okay, and there may be streaks covering large areas of the body. As you can see, for example, this image. Okay, there is large areas of the body. There are stretch marks. Okay, now I will tell you the causes. Okay, let's say like I type here stretch mark causes what appears. Okay, okay. So basically, this here it is showing causes of stretch marks. Okay, so as you can see, the causes of stretch marks are it's basically, first of all, let me tell you why it happens. Stretch the cause of stretch mark is stretching of the skin, and their severity is affected by several factors, including your genetics and the degree of stress on the skin. Your level of the hormone cortisol also might play a role. Cortisol is a hormone produced by the adrenal glands. It basically weakens elastic fibers in the skin. So if the elastic fibers in the skin weaken, then there are obviously chances of stretch marks. And the risk factors are that if you are a female, then there is a risk factor. Having a personal or family history of stretch marks, being pregnant, as you can see, most of these images are of the pregnant ladies, especially if you are, a younger lady. Okay. Also, there could be rapid growth in adolescence that can also lead to stretch marks in some people. Also, there is a possibility that if you are rapidly gaining or losing weight, then stretch mark can happen. And some people who use corticosteroids, okay, and they also, are liable to develop these stretch marks. Also, there is another risk factor that if there is a lady who wants to have a breast enlargement surgeries, and then these can appear. And people who exercise a lot and use anabolic steroids also have a more chance of this stretch marks. Also, if there is a genetic disorder such as Cushing syndrome or Marfan syndrome, then there are more chances of stretch marks. Now, coming to the diagnosis, well, diagnosis is not difficult, as you can see when there are so many images, and when the patients come to our clinic, we can easily diagnose by just examining your skin and taking this medical history. Okay, but if we suspect an increase in your level of the hormone cortisol, then we may order the test for that. Okay, coming to the treatment, let's say now I'll type the stretch marks treatment. Okay. Well, as you can see, there are so many creams and all these kind of available, but the one I'm telling you, these are mostly trade names, and I will tell you what is the appropriate treatment for this. Okay. Well, oftenly they, as I said before, the stretch marks do not require any treatment. They are harmless and often fade over time. Treatment can make them fade, but they may never completely disappear. So you have to remember this fact. Okay. And the treatment which I am going to tell you are available to improve the appearance and texture of stretch marks. but none of the treatment is has been proved to be more consistently successful than the others. Okay, the first treatment which is widely used is this retinide cream. Okay, retinide cream. If you see any product or cream which contains this retinine, okay, let's see. I type this retin A cream is a very famous cream. Retin A cream. What appears? Okay. Well, for example, this retin-A cream. So any cream which contains this A, for example, there are trade names like Renova or Avita. Okay, it's basically it is derived from vitamin A, also known as this vitamin A retinoids. Okay, so the most common name is tretinoin. Okay, so if you apply to your skin, that may improve the appearance of stretch marks less than a few months old. Tretinoin, when it was helps to rebuild a protein in the skin called collagen. Okay, basically it's a collagen problem. So when the protein collagen is rebuilt, then it makes the stretch marks look more like your normal skin. So that's the logic behind this. Okay, but you need to remember that this tretinoin can irritate your skin. If you are pregnant or nursing, you should talk with your healthcare provider about other treatment options, because possible side effects of retinol cream may affect the baby. So this thing you should remember. Then there's another option of light and laser therapies. Well, a variety of light and laser therapies are available. For example, if you type stretch mask laser therapy, then you can see there are so many images. Okay. So basically, I just wanted to tell you that there are a lot of options for light and laser therapies that might stimulate the growth of collagen or promote elasticity. So basically, the idea behind is to promote the growth of collagen. So, and your healthcare provider can help you determine which technique is right for you. Then there is another treatment option which is generally recommended. That is, called as micro needling. Okay. So basically, this treatment involves a handheld device, okay, and it has tiny needles that stimulate this collagen growth. This technique has less risk of skin color changes than does laser therapy. So it is the preferred first approach for people with darker skin. So if you have a darker skin, then this is the first approach. Okay, but you should work with your healthcare provider to choose the right treatment or combination of treatment for you. And you should consider the factor that how long you have had the stretch marks, your skin type, and convenience. Okay. Okay. Now I should tell you some lifestyle and home remedies. Well, many creams, ointments, and other products claim to prevent or treat stretch marks. There may be hundreds of videos on YouTube. Everyone is promoting their product, but I'm a qualified doctor, and I will not specifically tell you this one is a like a natural or herbal product is good, because of what happens is normally these products, and this especially so-called natural products, are not FDA approved. So any product which is not FDA approved, it is we do not recommend just simply openly. Okay, but there are products like they're made of cocoa butter, vitamin E, and glycolic acid. They seem to be okay. I mean, they are not harmful, but they just remember the fact that they probably won't help much either. Okay, so I mean, these cocoa butter, vitamin E, and glycolic acid are helpful, but you don't just simply rely on them that this will totally cure this stretch mask. Okay, and so you need to remember the stretch marks usually fade over time and do not need self care or home therapy. Okay. So this was my video about stretch marks. I hope you like this video. If you have any question, please do not forget to post your question in the comment section of the this video. So thanks for watching this video. See you in the next video. Bye for now.